Let's talk to Professor George Lomonossoff, virologist at the John Innes Centre, to see whether he can make any sense of it all. George, very good morning to you. Welcome.
Good morning.
Thanks very much indeed for joining us. It is, I mean, for those of us who are not virologists and who are not medical people and who are even not data specialists, it does seem as though there's an awful lot of information being used to make an awful lot of decisions, but it's not very clear to me whether they're using it the right way.
Yes, unfortunately, the data itself is only partial, which I think is one of the problems. It's gradually collected as the pandemic developed, and you don't really know quite what coverage you have. Now, obviously, as the track and trace system has increased the number of people, you're going to see it, as you'd expect, an increase in total number of cases, but also the coverage of the population is different. And also you get these other issues, which we heard in the last item about, that universities have put in their own track and trace system. So you're getting a lot more monitoring of people, particularly students at universities, which can sort of skew the data a bit as well.
Well, this is the thing that people have said to me, and I asked of our last guest, George Pascoe Watson, who's obviously not a medical person either, but, you know, the pubs were opened on July the 4th. You know, hospitality was able to make a bit more money than it had been able to do for the previous few months. There wasn't really a spike much in that at that time. There wasn't much of a spike when all sorts of people went to Bournemouth Beach and other places. There wasn't much of a spike when there were marches going on all over London. But now there is a spike, which coincides, it would appear, to people going back to university and people going back to school.
Yes, and of course, I mean, we're all sort of familiar with this kind of time of year is when you pick up sort of other respiratory illnesses. I mean, all sorts of coughs and sneezes. And of course, there was this slightly jokey title of people going to university getting fresh as flu.
Yeah.
All the events there. And so, yes, people are, the weather conditions are more conducive. They're generally cooler and damper to spread. But also this, you know, people gathering more indoors. I think, you know, you mentioned Bournemouth and the people outdoors in the summer. I think, you know, the evidence is reasonably clear that actually transmission outdoors is less likely, especially if you keep 2 meters apart. Whereas as we go into the autumn and winter, people are a lot more likely to gather indoors. I mean, certainly over the last week or so, when it's just been raining all the time.
Yeah. Yeah, but I mean, then again, you get the Sage people saying that they're not convinced. I mean, we haven't yet had it confirmed by the government that they're going to lock down a bunch of pubs and restaurants in the north of England, but it looks likely. But Sage apparently is saying they don't think there's any point in doing that because that's not going far enough.
Yes, and that's one of the problems we've got, in that there is this economic issue and the problems you get if you have a complete lockdown, and so you try partial ones so you don't get quite that severe damage. But it's only when you try and do a less severe version do you really see whether it's effective or not. And if the evidence is that it isn't effective, it doesn't make any difference, well, I suppose you've got two choices. You can just lift the restrictions and say it makes no difference. Or you can say, well, we've got to do something and make them more severe so they do something. And that's really the choice, I think, is going to emerge.
Yes, I think so. And I mean, as far as the winter goes, you know, we're hearing now from the government that that we may be taking some of these measures into April of next year. I guess the problem for them is that they just don't really know. I mean, if you were able to advise them, Professor, would you say to them, look, at some point or other, you need to move, like this big declaration has said, away from just concentrating seemingly only on one thing and looking at everything in the round? Because I think a lot of people in the country would like to see the government being a little bit more inclusive of those who need to work, those who need to get treatment for other problems that they may have medically.
Well, I think you're referring to the Great Barrington Declaration.
Yes.
I mean, which was an interesting document, and actually quite welcomed seeing it, because I think it got the debate going, which had sort of not really been there. The issue with that is it does rely on this concept of herd immunity, which in turn, to be effective, relies on immunity being long-lasting. I mean, it was originally, the term came from work on measles in the 1930s.
Right.
And that does give you lifelong immunity. So you can say, well, you'll build it up and then the population will effectively be immune. Now, of course, it doesn't always get passed on to subsequent generations, so it's still an issue.
Right.
But the problem is with this particular virus, we don't know how long lasting any immunity would be. And that would apply to vaccines as well. So in the modern world, it tends to only be used, the term, for vaccination programs, about the kind of rate of vaccine uptake you need to be effective.
Mm.
I don't think it's ever really been postulated as a sort of policy in human health, deliberately. It might have happened in the past, before any vaccines were available. And so it's really saying, well, we'll just let the virus spread as it will, and we'll see what
Yeah.
happens.
But it kind of seems to be doing that anyway. I mean, my argument with people who say, what, you just want to let it rip through the community, which is a rather kind of, it seems to me, unusually, strong way of putting it. It's not a question of letting it rip through the community, but when you see what's happening in the halls of residences in Newcastle, in Sheffield, in parts of the north of England where it seems to be spreading very rapidly, in parts of lockdown areas where it's spreading rapidly, it seems to be spreading rapidly no matter what you do.
Oh yes, but those are, of course, the halls of residence are particular kind of examples where people live close together. I mean, it's a long time since I've been a student, but my children were, and I'm not saying they're unpleasant or unhygienic, but it is quite close quarters.
Well, sometimes it can be. There's no question about that.
It definitely can be.
Yeah, but I mean, the thing is, surely then it would have been more sensible then for the universities themselves, or perhaps the government, to say maybe it's not such a great idea to actually open up the universities. Maybe keep everybody at home and do it online for a while, which is what they're now having to do anyway.
Yeah, which is, I mean, that's what I would have thought. I was a bit surprised it just went ahead, as it was, because a lot of universities had anyway, from last spring, when it was shut down, had actually those facilities in place.
Right.
And rather curiously, because I do some university lecturing, I know that there's been a sort of debate whether actually face-to-face, lecturing is actually worthwhile, or whether it should all be online anyway, because you're always recorded. And so maybe you don't have to do it. Now, I'd argue in the normal run against that, but maybe I would anyway, in that you're there really just to get people interested.
Yes. But I think that's that's kind of where we are now, isn't it? Because it's not just about any longer trying to control a virus, because I'm going to ask you in a minute whether you think the virus is in some way changed and is less volatile and less dangerous, because lots of people have views on that. But I think surely the time has now come, sort of more or less, 7 or 8 months down the track, as to whether or not we take views like that one you've just espoused, which is, let's not bother sending anyone to university, let them all work from home. Let's not bother sending anyone to work, let them all work from home. That has massive repercussions for the rest of society, doesn't it?
Yeah. Well, I wasn't really necessarily saying about work. I mean, because you don't tend to live. Well, there'll be certain.
No, but there are people who would say that,
And you could say it's just a workplace. And I think what you have to do is get some data from it. So we are getting it from halls of residence now, which says, well, yes, sort of predictably, because of the nature of that and the close proximity, they were always likely to be a problem. And so that was predicted, and unfortunately has duly come to pass. There must be some information, I imagine, coming in from workplaces and public transport. And of course, on public transport, well, some people are on it for several hours a day, I have to say.
Yeah. But
with social distancing and measures, you could say, well, yes, we can protect ourselves, mask wearing, take various mitigation measures. So you may not have to do that. So you can try and be more targeted, but all that does rely on having very efficient tracking and tracing methods.
And it doesn't appear to be that very good at tracking or tracing at the moment, does it?
Yeah, I mean, that is the thing. I think, did I hear the figure that it's called the NHS app. I don't think it's particularly NHS, but a badge that way, that there's only been 4 warnings issued through it.
Yeah.
Now that could be a good thing that there haven't been many cases, but I suspect it's just.
But this is the problem, isn't it, Professor? Because you get on the one hand, everyone telling you cases are going through the roof, and on the other hand, the NHS app saying, well, actually, we've only told 4 people that they've come into contact with one another. It's all very contradictory, it seems to me.
Yeah, and I mean, there is people that often make the comparison, and I've heard it again today about places like South Korea, that actually who haven't had either the same rate of illness or the same economic hit, and it probably is down more to the efficiency of tracing people. And it's not just mass testing there. I don't think they've done massive amounts. Certainly, I don't think as many per head as we have. But it's how you use that information to quickly trace people and isolate people who've been in contact.
Exactly right. And what about finally the actual state of the virus itself? Are you one of those people who thinks that it has perhaps become slightly less dangerous, if you like?
I probably don't think that's happened. It certainly mutates. And there was that very interesting study, I mean, meat and drink to virologists, about being able to look at various individual mutations, which enabled people to track how many events there were which brought COVID-19 into the UK. You can actually see several different lineages, like a family tree, as it were. But the thing about coronavirus is it does seem to mutate rather less frequently than things like influenza. One reason for that is it's got just one long segment of genome, whereas influenza has 8, and you get this reassortment, and you can swap bits. And we had swine flu over 10 years ago, which picked up a segment from a pig infecting strain, and so you get this reassortment, so new things emerge very rapidly. Coronavirus doesn't do it in that way, and it does seem to not accumulate the same kind of mutations. It's possible, and there've been, possible some different, lineages. I imagine some will have a slightly different effect. That can happen, but one of of course, the problems of this mutation is that even if you do get immunity in a population, that then puts selection pressure for the accumulation of mutations to overcome it. So you end up with this kind of arms race going on.
Yes, and we're all losing it at the moment, I'm afraid. Professor George Lomonossoff, thank you very much indeed, virologist at the John Innes Centre